Hello everyone, welcome to VCHS. In today's video, we are going to understand the difference between modifier 50 and modifier 52, a very important concept in medical coding. Understanding modifier is essential in medical coding because incorrect usage can result in claim denial and payment issues. So let's understand this clearly and practically. First, let's talk about modifier 50. Modifier 50 indicates a bilateral procedure. This means the same procedure is performed on both the sides of the body during the same session. For example, if a procedure is done on both the left and right sides, we append modifier 50 to indicate a bilateral service. Important point, modifier 50 is used only when the CPT code description does not already mention bilateral. Always check the CPT code description before appending modifier 50. Now let's understand modifier 52. Modifier 52 indicates a reduced service. This means the procedure was partially reduced or eliminated at the physician discretion. It is used when a service is partially performed, a bilateral code is used but only one side was performed. Modifier 52 tells the payer that the full service was not completed. Now let's clearly see the difference between modifier 50 and 52. Modifier 50 is used for bilateral procedures. Same procedure performed on both the sides. Indicates increased work. Modifier 52 used for reduced service. Procedure partially performed indicates a reduced work. So remember 50 both the sides, 52 reduced service. A very simple trick to remember. Proper implementation of modifier is very important in billing. Incorrect usage can lead to claim denial, payment reduction, audit issues. Also remember, a different insurance payers may have a different rules regarding modifier acceptance. So always verify payer guidelines before billing. See, for an example, here the foot x-ray codes in the CPT book. For 2 views you will find a 73620. For 3 views it's a 73630. Based on the medical record documentation, we'll assign the CPT codes. See, for an example, 3 views taken, we report 73630. 2 views were taken, we report 73620. Only one view was taken. There is no separate CPT code for a one view, single view. So we append modifier 52 to indicate it's a reduced service. For bilateral procedures, if the same procedure is done on both the feet in the same session, we can bill either with the 73620 with the 50 modifier or 73620 RT, 73620 LT. It depends on the insurance payer, insurance company. Now let's test your knowledge. For right side screening mammography, take a moment and think about it. The correct answer is option D, 77067 52 modifier. The CPT code 77067 represents it's a screening mammography bilateral, meaning both the breast. But in this question, screening was done only on the right side. Since the CPT code requires bilateral screening but only one side was performed, we must indicate a reduced service. So we append modifier 52. Important tip, do not append modifier 50 to add-on codes because add-on codes are already designed to be reported with the primary procedure and usually reflect additional work including bilateral aspects when applicable. Always read the CPT guidelines carefully. Thank you for watching this session. I hope this explanation gave you clear understanding of the difference between modifier 50 and modifier 52 and how to apply them correctly in real-time coding scenarios. Accurate modifier usage is critical in medical billing and directly impact claim acceptance and reimbursement. In upcoming sessions, we will continue covering important medical coding concepts and CPC exam oriented topics. Stay committed to learning and practice consistently. This is VCHS. Thank you.